All right, we're going to go ahead and get started here. So today's presentation is just going to go over the new client 711, the new screens that are involved with the ICD-10 functionality. We're going to go through a couple of patient examples here and charting and how the billing is going to come out. I'm going to show you, where in configuration the diagnoses are and all that, so you can see how this is all set up and get prepared to go live with ICD-10. You have the option to ask some questions there in the little chat. So at any time you feel like you have a question, just type it in there, and then at the end we'll go back through all the questions and see if we can get those answers for you. So everybody's on mute right now, so you can't ask any questions over the phone. So just type it in there and we'll get to it at the end. All right, first, what we want to do is kind of go in here and look and see how these SNOMED-based assessments are set up and how they're tied to the ICD-10 codes. So I'm just going to start off in configuration and go to diagnoses here. And I'm just going to look at these. You'll notice here on the screen that you have the green M's here. You also have the red U's. The green M's mean these are managed assessments here. So there's certain things you can and cannot do with these managed assessments. The U's are the ones that you have created. You can do whatever you want with those. We will update the managed assessments if there's any change with those, and so we have to keep them the way they are. That's why we do not allow you to edit them or anything like that, but I will show you what you can do with these. So for instance, let's go in here and look at abnormal urinalysis. I'm just going to go in here to the configuration. You'll see this is a pretty similar screen to what you're used to seeing, but you see stuff that's grayed out. These grayed out fields are no longer editable. You cannot click in here and do anything with these. Okay, the only thing that you can adjust on these are the auto close rules. You can adjust the risk level, and you can put your own user-defined name that will be searchable. So if I want to put whatever name in here that I want to call this diagnosis, I can put that in here and also search off that name as well. So to see which ICD-10s are mapped to this SNOMED assessment here, you click on this tab over here. This is a new tab. It's called ICD-10 Billing Code. And clicking on that tab, I can see that there are 3 ICD-10 map codes to this SNOMED-based assessment, okay? So here are the codes here. You can't do anything with these codes. This is informational only, so you can just kind of see which ones that are mapped to this, okay? And you can add your own new assessments if you want. They just cannot be associated with a 10 right now. What you'll do, and I'll show you this later in the demo, is you will come to a screen where you can just pick the 10 at the time of diagnosing. But in the future, you will be able to associate your own 10s from this screen here. You just can't do that right now. So that's the basic configuration of these assessments and what you can and cannot do with these. All right, let's go into an actual patient here and diagnose the patient with some of these new assessments. So I'm just going to come in here to new sick diagnosis like always, and it's going to bring me to the list of the new SNOMED assessments, and I'm just going to get a list of them all here. And some new features on this screen would be clicking on this green M. If I click on this green M, I can see what the default code is that is associated with it. See, this one is associated with unspecified abdominal pain, R10.9. Why is this the least specific one? It's because I have not defined the specificity yet. So you'll see these exclamation points next to the actual 10 code. What that means is that I must answer a question, a location or a severity or something like that in order for it to give me the correct billing code that I need. So you'll see here that you have the ICD-10 code here. You have the mapped ICD-9 code, if there is one, listed here. You have the SNOMED code listed here. And then if I had a user-defined name, it would be right underneath the actual name here that is managed. So let's just go here and click on this assessment. Here's the question that I have to answer in order to get that correct ICD-10 billing code. So based on my answer here, the computer is going to select the correct code to actually to map to. So I'm just going to pick this and come in here, and it's going to bring me to the treatment list like always. And I'm just going to put here patient instruction. And then when I get back to the sub screen, you'll see here that I have two kind of codes here. The first one up here is the SNOMED based description and the SNOMED code. Right below that is the ICD-10 description and the ICD-10 code. Okay, so that was based off of what I picked, and that's what it mapped to. So if I want to change this ICD-10 code, I certainly can do that by clicking on the assessment and coming to the new tab here that is Billing ICD-10. So when I come to this Billing ICD-10, I can see what the computer picked for me. If I don't like that, I can unclick that one and just scroll down in the family and pick the actual one that I want, more specific or something like that. And then I can submit and override, and that will change the code for me to what I have selected. Okay, so I can associate any 10 code with a SNOMED based assessment during the encounter. I can also add an additional ICD-10 code from this screen as well by coming back in here to the billing. And I have this new box here with the search and then selected items. I can search for the ICD-10 code that I want to bill with this. So, I know this is not clinically right, but I'm just going to pick one of these. Another feature on this screen is you can see that this is an ICD billing code search. So this is different from actually searching the assessments. So let me just bring them up all. So this is going to be all ICD-10 codes that are available. So you can search by ICD-10 code. You can search by description if you want. You'll see that there are green check marks and red check marks. The red indicates that this is a non-billable code. You really want to get more specific than that in order to bill it. The green means you can bill that code. It's specific enough. I can also click on the actual code here itself to bring up the tree view. So I can see the whole family of codes in this. So if I click here, you'll see that it brings up this tree view for me. You can see the green arrows that are billable codes, and you can see the red arrows that are non-billable codes. If I don't like this paratyphoid fever unspecified, I can pick another one that is more specific, like this, for instance, and that is what is going to be selected, okay? And then once I select that one, I am going to submit override, and that is going to add that code right here to this assessment as well. Okay, another thing that that might be a little new. I mean, you had this in the past as well, but we've added laterality to a lot of these codes because ICD-10 requires, to specify the laterality in order to build the correct code. So like that abdominal pain where I had to select the actual location, I will also select laterality on a lot of codes. So let's take a look at otitis media, for instance. So here you notice I have acute serous otitis media. Here's a SNOMED based SNOMED code, And here's the 10. It has the exclamation point, so that means that I need to get more, based off of my answer to the question, it's going to pick the code for me. So I'll do right, and then just come back here and bring me to the treatment list. And you can see that it bills the right ear here associated with that assessment. And then let's just take a look at one more sick assessment just for demonstration purposes, and I'll do an asthma. You'll notice here that you have individual SNOMED codes for mild intermittent, mild persistent, moderate persistent, severe persistent. Those are all separate SNOMED-based assessments now, but you can see they're tied back to the same 9 code here. All right, and then once you click on one of these, it's going to ask you a question here with acute exacerbation, with status asthmaticus, or uncomplicated. So it's going to pick the correct 10 code based off of this selection here. And there's how that looks here, okay? So now I'm just going to exit out and get to the billing screen, and this is the same as it's always looked. It's just going to have 10 codes in here now instead of the 9s. I can change the 10 codes from here as well by clicking on the actual code, and clicking on that code is going to take me to the tree view for that code, just like it did before, and you can see what I'm selected on, and I can scroll down through the tree and look at the actual one that I need to bill. If it's the wrong one, get more specific, whatever you need to do. If I need to change one of these, you click on that, you click OK, and then it's going to give me a little warning. Hey, do you really want to replace this? If I do, I replace it and it changes here. I can also move these up and down just like always, and everything like that. So that was a rundown of a basic, just doing sick diagnoses and how the new screens are actually going to look. Now I am going to show you what the well visit looks like, and a specific calculation that happens on certain diagnoses now, including the well visits. The computer actually looks for to see if you have diagnosed the patient with any sick diagnoses during the encounter, and based off that calculation, it's going to bill one code or the other. So let me show you what I'm talking about with that. I'm going to come in here, and I'm at the point to where I'm ready to diagnose this patient. So I'm just going to come in here and do an auto well. Oh, don't want to do the auto well because obviously that one's still hooked up to the 9. So I will pick a well. So here's my well visit. You can see that I didn't answer any questions on this one. The computer figured out, based off of this encounter, which code to bill. So you'll notice that it billed the encounter for routine child health examination without abnormal findings. This without abnormal findings is due to the fact that I do not have any sick diagnosis with this during this encounter. If I did, then I would it would flip. And let me show you how this actually flips by going in here and ordering a sick diagnosis doing this as well. And there it just flipped to with abnormal findings, and the code actually flipped to what it's supposed to be now because I have a sick diagnosis in here along with the well child. And there's a couple other ones that will flip based off of that same calculation. So that brings me to a point where I need to show you a new kind of category we have here called status history other. And we have this category due to this calculation right here. So we have had to put specific assessments in here in this category because we don't want them to trigger that calculation that just happened. Because, you know, this is not an actual abnormal finding, but this is something that we do during a well visit. So we wouldn't want that we wouldn't want to make this like a sick diagnosis or anything like that, because then it would make that well visit flip, and we do not want that. So we have put these codes in here, and these codes will not trigger any of those calculations to flip or anything like that. So if I want to add one of these diagnoses to my sick shortlist, I can do that so I don't have to flip, you know, assessment types if I don't want to. It will still have the assessment type of status history other, but you can put that on your sick shortlist. So I am going to just click on the icon here, add to my common shortlist. That's because I'm on this button. Hang on, I'm going to go to new sick diagnosis, and I'm going to flip it here. And then if I want to add one of these to my sick diagnoses, my sick shortlist, I click on it and common shortlist. Then it's going to ask me which shortlist do I actually want to add it to, and I can add it to the sick shortlist, and then it will be there. So if I don't want to flip back and forth between these, you can add these to your sick shortlist as well and get to them easy. All right, so let's talk about if I come in here and I can't find a SNOMED-based diagnosis that, you know, works for me. So, you know, I'm kind of stuck. What do I do? Well, we're going to have, right now, there is no button for a category. There will be a button in the future for category, and you can select, you know, specific categories that you want to look at. And we have a category called catch-all. The catch-all codes are going to be, you know, the lowest specificity that you can have. And, you know, it's just kind of something to use, and you can associate, you know, the specific TIN code that you want to bill with that catch-all code. So for instance, let's look at a catch-all code. This is a catch-all code, the disorder of digestive system. Say something was really wrong here with their digestive system, but I can't find these specifics SNOMED-based assessment. What I'm going to do is I'm going to just order this generic catch-all SNOMED-based assessment. And then when I order that, it's going to default to this unspecified, you know, but I can come in here and I can actually click on I can come in here and search for the specific ICD 10 code that I want, okay? And submit override. And then, you know, that is what's going to bill, okay, with that catch-all code. So if you get stuck, you're going to use one of these catch-alls, and, you know, let us know what's not in there as well, and we will get that in there. But if you're in the middle of seeing patients and you can't find something, use these catch-alls, and then you can quickly, you know, move on and pick the specific TIN code that you want to associate with that SNOMED based assessment. One other thing I wanted to talk about this screen is we've had some feedback from a couple, you know, people that have been using this. They say this kind of gets crowded with the billing code and the assessment showing. So in the future, the preference for showing this 10 code is going to be, you'll have a preference to either show that or not show that. So I know some people think this gets a little crowded, so you can take this 10 from showing off the screen if you want in the future. Another thing that I want to talk about is the preference to set the billing to bill either 9 or ICD 10. So, you know, in the next couple of weeks, we'll be installing this client to your practice, and you will want to kind of run some test patients through, play with it, see how it's going to work, you know, during your downtime, you know, when you're not not in normal business hours and stuff like that. You'll want to flip that ICD-10, that billing preference to ICD-10, and then run test patients through whatever you want to do, play around with it. And then when you're seeing real patients, what you want to do is keep that in ICD-9 during September till October 1, so you'll still bill 9 codes out while you're really seeing patients on a day-to-day basis. But that preference is a global preference. So if one person changes that preference, it's changed for the whole system. So be careful with changing that over back and forth. But I'll show you what that preference looks like here. In configuration, you go to preferences, and it's under billing preferences here. And if you scroll down, you will see that you have an ICD-9 billing code set to use for bill codes. You either have ICD-10 or ICD-9. I'm set in ICD-10 because I want to bill it. If I wanted to go back to 9, I just delete out the 10 and put in 9 and click finished, and then it will bill 9s. All right. So that is the basic overview of the new screens and what it's going to look like and how to use the system to bill ICD-10 codes. So now I'll look at the questions, see if we have any, and go over those. So if y'all have any questions, start typing them in and we can go over these. Okay, well, let's see. Will ePro allow us to choose a code with a red U and bill under that code? Yes, you can pick a red U code and you can associate any 10 code with that red U. So let's go in here and take a look. Well, okay, so you notice that I don't have the managed and unmanaged assessments anymore. That's because I'm in ICD-9 billing mode now, and there's no such thing as that when I'm in ICD-9. So I got to come back and flip the preference. All right, so for instance, let's take a look at one of these old ones. So I come in here, I search for a 10 code that I want to bill out, and I'm just going to pick one. Okay, okay, so what you're going to have to do is when you create a new one, the old ICD-9s will not allow you to associate the 10 code. So once you create a new assessment, though, if I went in here to this new assessment, created one, then I can pick a 10 to associate with it. But the old 9 codes will not allow you to bill a 10 code out. All right, does the abnormal finding diagnosis apply when a doctor refers a patient to a specialist? No, the abnormal finding will only flip when with a sick diagnosis that is ordered, or if you ordered a referral underneath a sick diagnosis during that well visit, then yes, it would flip. But if you touch any of the sick diagnoses and do anything on those and cause them to bill for that day, then it will flip to the abnormal finding. So that's that. All right, so show us the billing room. Okay, let's take a look at the billing room. The billing room has not changed. It is the same here. Oops, sorry. Billing review brings you to the soap screen like always, and then when you hit the exit, it brings you to this same screen here, and I can change the codes if I would like. And then obviously after you're finished and you approve that, it goes to checkout. All right, so some people have questions about how is the interface with the PM software third party going to work like PCC. So what we are in the process of doing is converting everybody that was on the old services way to the new plugin to handle the interface with the PM companies. So it's just a small little change in the actual file that gets sent to them in the message. We now are sending ICD-10 codes instead of that. And if you need to, test with your PM company to see how it's going to work, we can get you some sample messages over and you can provide them to the PM company and they will, test those out for you. All right, so the next question is, how do you transfer your treatment plans over to the new assessments? All right, so let's take a look at that. I'm just going to order a sick assessment. All right, you notice that I do not have a treatment list, a common list for this assessment. So let's say that I had an ICD-9 acne treatment plan already built and I want to copy that over to this one. Well, I can do that by hitting this copy from button down here in the bottom right. And it's going to say, what do I want to copy? Another assessment common list, another assessment personal list. So I'm going to say another assessment common list. And then I can pick any one that I want to, and it will copy it over there. So let me just do, I know I have a treatment plan for otitis, I believe. And then I have the treatment plan from that diagnosis. So you can copy those easily over if you come up with a blank one. And then if you do not have one to copy from, you can always copy from the default list, to get, and you won't have treatments on your default list. You'll just have the groups, so you can start with something as a little template to use. All right, next. Are the practices responsible for setting their own auto-close rules? So what we are doing is if we can map it back to a 9 code that you currently have, those will have the same auto close rules as the 9 codes did. But yes, if you do not have a map to a 9, you will be responsible for setting your own auto close rules for those. Okay, for the well visit sick finding, does ePro establish the 2559 modifiers? If you have that set up in the system, yes, you certainly can have the 25 and 59 modifiers hooked up to that code. Will there be another webinar for all of our providers? So what we're doing is we're recording this webinar, and we're going to be sending it out to whoever wants it. We'll send it out to everybody. There is another one today at 1, and then there will be more next week as well. So there will be many options for everybody to join. How soon can we get the ICD-10 shell database loaded on our system? All right, right now we are in beta with this, and we're finishing out the beta process. If we get the all clear, then we'll start installing this next week to everybody. Will it automatically prompt for episode of care for the codes that require that? So let's talk about that. So is this the initial encounter, subsequent, the sequela, all of that? Right now, the system cannot calculate the episode of care because you haven't used these new codes. So in the next few months, when you start using these codes, the calculation the next time they come in there will happen based off a preference you set for that assessment. So everybody's recurrence and stuff like that can be set for each individual diagnosis. So if you prefer to have 3 months as a recurrence, you can set that. 6 months, whatever your preference is, you can set that. But for the episode of care, yeah, it's going to calculate if you have had that sick assessment, still open in the past. The system will look back to say, is this a initial encounter or a subsequent? But at the beginning, you are going to have to pick that that code that you want because the system cannot calculate that yet. Can I pass my personalized info under treatment plan to the new ICD-10 diagnosis without having to start from scratch? Yes, you can. So just like what we did here to copy from, you can also copy from another personal list, and it will add it to the personal list for you on this assessment. So it's the same functionality as copying that common list from another one. You just copy a personal list from another one. Will personal lists be automatically updated with new codes, or will physicians need to build new lists? The personal lists will be populated for the ones that we can map back to an ICD-9 code. So the first 250 that you most of y'all already have, those are mapped to 9. So yes, those treatment plans will be there. And then you're going to get another load of content that will also be mapped to 9s that you will have those treatment plans for those as well. Are we able to get screenshots and information from the presentation? Yes, you will have the recording. Will it let you pick a 5-digit code when a 6-digit is required? Yes, it will. It will allow you to. You just got to kind of know that you need to get more specific if you need to. Now, there are some codes that need a 7th digit, and there is not 6 digits to even fill out the code before the 7th digit. So they have a placeholder in that 6th digit which is an X, and that's already done for you, the placeholder. So that's how that works. But yes, it will allow you to pick a non, if you need more specificity, it will let you pick that non-specific code and still build that out. So can we remove the old ICD-9 codes? You can remove them, yes, off the short list, and you can remove them from, when you first get started with this, you're going to be re-diagnosing the old 9 codes anyway. So yeah, you can remove those from any of your short lists, anything like that. You don't want to delete them out of the system because, those 9 codes are part of historical records and you want to have that reference still. What does it look like for referrals? I'm not quite sure what we mean by that, Diana. So if you want to kind of type in a more specific thing about referrals, go ahead. When you choose well with abnormal findings, does it bill both well and sick visit? What it does is it bills the well code, but you will have to put the modifier on there if you need to, and associate that sick visit with the office visit. That sick diagnosis with the office visit. Is there a different billing reimbursement if a well checkup has associated abnormal findings? Not sure on that one. I'm sure there is a different billing code now, so that is something that's different. But I'm sure the reimbursement's the same. But I can't be sure on that. Can we get a contact name of someone we can get on a conference call with our PM system? Sure. If you just reach out to the help desk, we can get you set up and scheduled for a conference call with them. That's no problem. Are there specific catch-all diagnoses to select, or does a populated list come up when the category button is selected? Yeah, when that category button is there, yes, you will be able to filter that list to only show you the catch-all codes. Right now, you you're just going to have to search for them, and but that button will be back shortly to be able to see the category and to only see that list. Will existing treatment lists transfer over to the map via SNOMED codes? Yes, we've already gone over that. I want it for sure. Chris, are you doing? Oh, thanks, Shelly. Well, a diagnosis that you selected from the status codes that were added to your short sick list automatically change the well diagnosis to abnormal finding? No, it will not, because those are not classified as sick diagnoses. Even though you added it to your short sick list, it still has the assessment type of status history other, so it will not flip the billing. That's why we put them in that category, so you can order those during a well visit or a sick visit, and it's not going to flip it at all. When a referral is input, does it still look the same? Yes, it still looks exactly the same. If we want to test the billing, we have to flip our configuration to 10, bill a few test patients, send the billing, and confirm if our P is receiving correctly. Yes, that's how you're going to do it, and I would recommend doing that, early in the morning or after hours or during lunch, something like that. Certainly just run a couple test patients through, produce the messages, and they should have them in their folder waiting to be picked up, and they can process those. Will our links related to the visit stay the same? Debbie Maud, what links are you speaking about there? All right, will you guys be adding new content to the common treatment plans, or will they be blank or the old stuff? What it will be is if there is a ICD-9 that we can map back to with these new assessments, then you will have that treatment plan that you had on your old ICD-9 code. If there's nothing for us to map back to, or you didn't have a treatment plan for that, then they will come out blank and you will have to either copy from another list or start building your own. All right, yeah, just answer that. Does the steps of inputting a referral still the same? Yes, exactly the same for referral. Will it automatically prompt you to put tobacco use on the J codes? I think, Martina, are you asking if you order a J code like tobacco, will it prompt you to order the ICD-10 tobacco use code? I'm not clear on that one. Define produce the messages during the test. Oh, that's just completing the encounter. When you complete the encounter, it goes to that green check mark. That is actually the message being produced and sending over to your PM. So that's what I meant by just producing the messages. Yeah, the visit codes are not going to change, Debbie. How soon can we receive today's webinar recording? I've actually never recorded one of these things, so I'm going to have to see, what format it's in and how we can get it out to you, if we need to put it somewhere for y'all to access or if we can just email it. So if I can get it out today, I will be sending it out later on today. All right, Dr. Ragu, what if the old common ICD-9 is sloppy and we could use the out-of-the-box content? I guess if we mapped it to your old 9 and it's sloppy, you're just going to have to delete that and clear it out, but and make your own. But we're mapping back to what we can so we can try to have the least impact on you guys. Is there currently a way to practice ICD-10 with test patients, or do we need to wait until installation next week? Yeah, there's currently not a way to test until you have this new client with all these new screens and everything. So you have to wait until you get this client. Will the referrals, when printed out, show the ICD-10 code? Yes, they will have the ICD-10 code. All right, so if you use the J code, like a respiratory code, you are supposed to add tobacco exposure. Does it prompt you to do this? Nope, it's not going to prompt you to do that. You got to know the rules, the coding rules and everything like that. So if I order that, I just got to know I have to associate the tobacco exposure code as well with that. When will we have the new client to test? I'm hoping, right now we are in beta, and if everything goes good, we're hoping to get this out next week to you guys. Okay, I don't see any more questions coming through, so last chance to get any questions in, and then we'll end this meeting. So if y'all have any more last minute questions, go ahead and shoot. Thank you, Debbie. Thank you, Mike. The timing of the visit on sick visits, is that determined by the time of visit? Marianne, I'm a little confused by that. So are you talking about like initial encounter, subsequent? Can you give me an example of a specific code that you're talking about that's determined by time of visit? Yeah, that's not going to change. The office visit level, is still going to be calculated by, the amount of history you put in, all that stuff that it calculates based now. That is the same. Will you use our current email to send the recorded webinars? So when y'all registered for this webinar, you put in your email address, and I have a report of that. So I will use those emails, and we will also use the normal emails that we blast out, the updates to. We'll also send it to those as well. So we'll send it to all the individual people that attended today, as well as the normal, people that get the emails for your practice from us. All right, so is there anything else? I don't see any more questions. All right, thank you for your time. And if you have any questions, you can reach out to me anytime. You all have my email address now, so shoot me an email if you have specific questions on this. I'll be getting you this recording out hopefully today. And also remember that we're offering more webinars, so if you want to attend another one, you're certainly welcome to do that. We have one today at 1 o'clock, and then we'll have a couple more next week. So we'll be sending out an email with the times next week, I think next Tuesday, and I think we're planning on Wednesday and Friday, same times. We might make one for the 12 o'clock hour so people can get in there during their lunch hour. But if you want to sign up for those, it will be the same email that came for these. And I appreciate everyone's time, and I hope y'all are a little more at ease with seeing this, and look forward to using it. Look forward to working with all y'all. Thank you.